Good morning, class. My name is Hunter Covington, and this is my interview PowerPoint. So today, I had the privilege to talk to Chanel Nagaishi. Chanel is a social worker who works in Utah County as a clinical social worker. She has her MSW and is currently working towards her LCSW. She works at a clinic called Jill Sabine Smart and Associates. So, what is a clinical social worker? It is a specialty practice area of social work which focuses on assessment, diagnosis, treatment, and prevention of mental illness, emotional, and other behavioral disturbances. Individual, group, and family therapy are common treatment modalities. Her description of the agency: she works for a private practice, private therapy practice in Spanish Fork. It is an outpatient clinic that caters to adults, adolescents, and children. There are 4 part-time therapists who are employed here, one of whom is the supervisor and owner of the practice. The mission of the agency. She didn't really have an official mission of the agency, but she would sum up their job is to provide quality mental health care for those living in the southern part of Utah County. Her clientele: as an outpatient clinic, they mainly cater to those struggling with anxiety, depression, and effects of trauma. They see clients ages 5 and up, men and women. The responsibilities at her agency. Her main responsibilities are administer biopsychological spiritual assessment to clients at the initial intake appointment, develop treatment goals with clients, diagnose clients with a mental health disorder using the DSM-5, create treatment plans with clients, provide weekly based therapy sessions, and write discharge summaries for clients who are terminating therapy. Separation of private life from professional life, self-disclosure, and maintaining of professional relationships between you and your clients. This one was a big one for her. I couldn't fit everything in, but basically she just stated how important it is between the private life and professional life, having boundaries, making sure that you have things to preoccupy yourself outside of your work that can help you de-stress and stuff like that. Boundaries, she just said make sure you have boundaries that will prevent you from overheating or burning out mainly. One thing for her is having her kid. It helps her to be able to leave work and come home and focus on her family life. Professional relationships between her and her clients. So it's hard for her because she can't go home and talk to her husband about some of her clients just because it's very personal. So she said one nice thing is being able to work with others. She is able to talk to them about maybe the concerns that are going on. And then with her clients, she was telling how she starts out by having them ask her questions that maybe will help them feel more comfortable about talking about stuff that's very personal to them. And it can be as simple as like, do you have family? Do you have kids? Where did you go to school? And then she also said she would never give a hug to somebody unless somebody asked for a hug. So that's kind of her professional relationship with clients and how she deals with stuff at home as well. The starting salary is $30 an hour for a licensed therapist who still requires supervision. Opportunities for advancement. There isn't very many, but she's able to choose her hours, and it constantly changes. And once the therapist is no longer required supervision, their pay increases. Overall job satisfaction. She's incredibly satisfied with her job. She loves her clients who she is privileged to work with, as well as her supervisor. She's fortunate that her job is so flexible that she can so that she can choose how many clients she wants to see and when she wants to see them. She says it is a great job for someone like her who wants to stay at home with her kids but also wants to keep her clinical skills and continue helping others.